Dreaming of a better sleep? Tossing and turning is not your destiny. And Ollie is here to help. Ollie invites you to sink into sweet, sweet slumber to improve your mental and physical health and overall wellness. More than just melatonin, Ollie's ingredients help you unwind your mind for a delightfully dreamy drift off. Sleep is on the way at Ollie.com. That's OLLY.com.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by our pediatrician bestie, Dr. Dina DiMaggio. Hello, Dina.
Hello, Jess.
All right. So sudden infant death syndrome, known as SIDS, is the term used to describe the sudden death of a baby younger than 1 year of age that doesn't have a known cause, even after a full investigation. Let's talk about this. The clock is ticking. Let's get to it. Dina, can you tell us a bit more about SIDS and how many people are affected?
Sure. So every year, more than 3,000 babies in the U.S. die of sudden infant death syndrome, which is the unexplained death of a healthy baby less than a year old. So SIDS peaks around 1 to 4 months of age, and 90% of the cases take place in the first 6 months of life. Currently, the cause of SIDS is not known, but it's believed, though, to happen when a baby cannot wake up, to move their head when they are not getting enough oxygen. It also may be thought to be due to heart issues, seizures, or an abnormal immune response to infections.
Are there certain risk factors for SIDS?
Yes. So we know that babies who are born preterm or with a low birth weight under 5 pounds, 8 ounces, or 2 to 3 times more likely to die of SIDS. Smoking and drinking during pregnancy also puts your baby at higher risk. So according to the AAP, it's been estimated that if everyone stopped smoking during pregnancy, up to 1/3 of SIDS deaths could be avoided, and that smoking even 1 cigarette per day while pregnant doubles the risk of SIDS. Secondhand smoke exposure to a baby also increases the risk of SIDS.
And of course, there are so many reasons why you should absolutely never smoke during pregnancy or after pregnancy, but that's another conversation. So what are things that we can do to prevent SIDS?
So we always recommend the ABCs of sleep, that a baby should be alone on their back on a firm surface, flat surface, like a crib or bassinet. Babies should always be placed on their back to sleep, since babies who sleep on their stomachs may sleep more deeply, and it's harder for them to wake up if they're not getting enough oxygen. They should sleep alone without any blankets, toys, bumpers, or any nests, like the DockATot, since these soft surfaces can block their airways. There's a higher risk of SIDS also with overheating, so keep your baby's room comfortable and don't bundle them up too much. So the basic rule of thumb is that your baby should wear one more layer than you are wearing. And although there is no one quote unquote it temperature to keep a baby's room at, most of us will recommend keeping the room temperature between 68 to 72 degrees Fahrenheit.
All right. So what do you say to people who say, I love sleeping with my baby and they're fine and we both sleep more comfortably? Why would I change that?
So although the AP recommends that sleeping in the same room as your infant for at least the first 6 months of life can decrease the risk of SIDS by 50%, this is not the same as sleeping in the same bed as your baby. So it's fine until it's not fine, and just because it's okay, and today doesn't mean it'll be okay tomorrow. So according to the AP, bed sharing has caused countless infant deaths, which occur when adults move during sleep and cause the baby to be in an unsafe sleep position. So in fact, the AP states, quote, unequivocally, that there is no safe way to sleep with your baby on the same bed, chair, couch, or other surface. I have also gotten countless calls from clinical experience of parents screaming on the other end when a baby has fallen out of the bed. And those are the facts. And of course, we are here to provide the information, and you need to make your own educated decision.
All right. So is there anything we can do to protect against SIDS?
So the best thing to do is to create a safe sleep environment along with a smoke-free environment. This also includes not leaving a baby to sleep for long periods in car seats and not to use recalled swings or nests, even though they are very beloved by parents. Breastfeeding also helps protect against SIDS. So according to the AP, breastfeeding for at least 2 months reduces your baby's risk of SIDS by at least 50%. It's not clear why, but maybe from the immune properties of breast milk, because breastfed babies may wake up more often and more easily. Pacifiers have also been shown to help protect babies from SIDS. So babies like to suck for comfort. So we definitely recommend using a pacifier if your baby will take one during naps and sleep time. Also, getting those required vaccines helps protect against SIDS.
All right. Well, I learned something. We hope you learned something, and we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.